Hello, I'm Dr. Eric Potter from Sanctuary Functional Medicine. I'm a functional MD, and I do Facebook Lives twice a month. Today we're going to talk about autoimmunity and its connections with mold and other environmental toxins. So if you're joining us for the first time, we have a practice here in Franklin, Tennessee, where we care for those who are chronically ill and have unexplained symptoms. We use a functional medicine approach to restore health and see patients get back on their feet, get back to work, get back to enjoying their life, and doing the things that God designed them to do. With that, we not only want to take care of patients that come to see us, but we want to provide information for those that are out there who either can't get in to see us, who live at a distance, or are just thinking about what kind of health problems they have and how to prevent. So we want to provide some education. So that's what these Facebook Lives are about. So don't take this as final medical advice. If there's something that we suggest that potentially sounds like something you might want to try, talk with your doctor or come see us so we can make sure it is a good fit for you and we're not just giving you advice that doesn't fit. So with that, we want to spend about the next 15 to 20 minutes. I'm going to do a little introduction to autoimmunity so to make sure we're all on the same page. And then we're going to spend time answering questions. Today we only had one question sent in, so any of you who are putting questions out there on Facebook, you're probably have a very good chance of getting those answered today about autoimmune disease. So let's get started. So let's talk about reversing autoimmune disease naturally, what it is. So how many of you out there do know someone with autoimmune disease? If you're like most people, you're hearing it right and left, whether it's Hashimoto's, whether it's celiac disease, whether it is lupus, Sjogren's, or other issues. And how many of them are taking medicines that are costing them a lot of money, that have a lot of side effects, and are still not necessarily freeing them from that disease? How would you like to use some natural remedies and look for root causes to get away from those expensive medicines? So autoimmune disease is basically when your body attacks itself. Your immune system, who normally is tasked with defending your body, suddenly starts attacking your skin, your brain tissue, your nerves, your liver, your lungs, your heart, any different parts of your body. It can even attack itself and be an autoimmune on the immune system. So with that, we are trying to find what root causes do that, and there's many mechanisms behind that. But as I alluded to earlier, this is a common thing. In 1996, there's about 8.5 million, 3/4 of which, 3 out of 4, were women. However, more recently, the National Institutes of Health looked at maybe 23.5 million people in America in their list of 24 different autoimmune diseases, which doesn't even cover all of them. So there may be 50 million if you consider other autoimmune connections, and ones we're even learning about, like the disease narcolepsy, actually looks like maybe partially autoimmune as well. Type 1 diabetes itself, which is an autoimmune attack on your pancreas, between 2001 and 2009 had a 23% increased incidence. So then we look at many others have similar, whether it's Crohn's, rheumatoid arthritis, lupus. There's an epidemic that doesn't have a clear explanation by mainstream medicine. So again, I said autoimmune disease is when the body's attacking itself. So normally you have B cells, T cells, mast cells, dendritic cells, all these different cells coordinating a defense. You have surface, where it's kind of surface barriers keeping infections, viruses, fungi, bacteria, different things out. And then you have, once they breach those barriers, you have cells that are trying to identify, attack, trigger other cells to attack, coordinated defense, and prevent those things from causing inflammation, causing tissue damage and destruction. Why does it do that? Well, there's a number of reasons, a number of theories, and part of the reason why there's probably a number of theories is it's not the same in everyone. And in many cases, it's not just one thing that is causing it. It's a combination, a multitude of things. It's not a one cause, one effect type of situation. So when we look at that, what are some of those theories? there can be inflammation. That's a common mechanism, but underneath that, your body has to identify tissue. So it's antibodies that your body's making to normally against invaders is now attacking your own tissue. Why would it do that? Why would it turn on itself? Well, it can be because it was attacking, say, a virus, which happened to have some similar proteins or similar DNA structure, and then it starts attacking your tissue, thinking it is that virus. Sometimes when we have a lot of tissue destruction, our body starts trying to clean things up and starts reacting to our tissue that normally would have not been reacted to. You can have some toxins that trigger, upregulate the immune system so much that it causes it to start attacking our own tissues. And there's this idea of genetic tendencies where some patients, some people have a higher likelihood of genetic predispositions where they either have a hyperactive immune system or they have a more predisposition to attacking yourself. So if you have those patients, they're not 100% guaranteed to get autoimmune disease. However, if you have an environment who the genetics loads the gun, as we say, and the environment pulls the trigger, you may find that people do develop that, whether it's an infection, whether it's a toxin, even foods. And if you get leaky gut, can trigger that. So genetic predispositions we'll talk about. And then I started talking about leaky gut. So if you have bacteria dysbiosis, not enough good bacteria or too many bad bacteria, can trigger gut problems where you allow other antigens, triggers for immune reaction into your bloodstream. Your body starts reacting to that. Then we look at things like yeast can also cause leaky gut. When that barrier protecting things from the inside to the outside of your gut breaks down, you start reacting to things. Foods can then become triggers. Gluten can be a trigger for celiac and autoimmune disease like thyroid, Hashimoto's, or type 1 diabetes. With that, a final thing that we are all exposed to is stress. So there's a number of studies, even Harvard, normally not somebody who's on the cutting edge of functional medicine, although we look to them occasionally for research studies. I did note that higher levels of stress greatly increases your risk of autoimmune disease. So now when we look at this, we're like, okay, let's just take something that suppresses the immune system or turns down inflammation. Well, it's not that simple. We do need inflammation. We need inflammation to identify cancer cells that may develop in our body. We need inflammation to take care of infections or even heal a wound. If you get a scratch, a cut, a wound, you have inflammation, builds that tissue up, and then it heals. So that can, steroids can slow wound healing, can make you more likely to get infections. So it's not just turning inflammation down or turning off the immune system with some of the targeted therapies that you see out there with the biologics, where they target one immune cell or they turn off one process, one hormone in the immune system. We want to do things more on a broad scale and not focus down to where we disable the good stuff while we're trying to fix the bad problems. So let's target things like getting rid of those infections, finding those foods that are triggered, finding those toxins and detox. Because the other issue is when you stop those biologics or anti-inflammatories, the disease comes back because you haven't fixed the root cause. So again, that's why we're looking for those root causes that may be underlying your condition. So rather than just living with your inflammation, living with your autoimmune disease, we're going to look for those things. How do we find them? Well, a good history. At Sanctuary, our first visit is at least an hour and a half with patients where we're digging into a person's story, their whole life, to know if they were exposed to toxins when they were a child, if their mom was exposed to toxins or infections. Looking at their life, their occupational history, where they lived, where they've been exposed to mold, which is another one of those triggers. Mold greatly dysregulates the immune system. It turns down your ability to fight infections and turns up your ability to attack yourself. So we will look for if someone's had water damage in their home, experienced a flood, started having symptoms moving into a new job or a new home or a new school. All of a sudden, like, hey, I've got these symptoms that don't make sense. Often mold is part of that issue. So we can do a good history, do a physical looking for signs, and then we do lab testing. We do tests like the anti-nuclear antibody to look for an autoimmune reaction. We may look at Hashimoto antibodies that look for a reaction to the thyroid. Then you can also look at some specialized antibodies, let's say for strep, anti-DNase, streptococcal M, and ASO, anti-streptolysin O. Strep can trigger cross reactions in things like PANS or PANDAS, pediatric autoimmune neuropsychiatric syndrome, or pediatric autoimmune neuropsychiatric disorder associated with strep. Regardless, that's when kids suddenly, after strep infection or other infections, get OCD, panic symptoms, anxiety, sleep problems, suddenly become a different child. That's an autoimmune process affecting the brain. With that, what we want to look for is what were those infections triggering that, and can we reverse those? Whether it's, oh, somebody's reacting to gluten, do we remove that? If somebody has a strep infection, do we treat that with natural therapies, not just antibiotics, but using natural therapies like garlic or biocidin, some of the products we use, get rid of those and keep them away. Boost the immune system in a good way, modulate it so it's working better, getting your vitamin D levels well. With that history, we're also going to, like I said, looking for mold, may need a detox mold, or we may find, oh, this all began after getting a series of vaccinations, concern for mercury or aluminum in those vaccines. So let's talk about foods for a moment. So again, foods can be secondary to leaky gut. You have a leaky gut. We've talked about this before, but it's the idea that normally the cells lining the gut are very tight and don't let things between them. But if you have leaky gut, those barriers, the connections loosen, and you start getting things going into the bloodstream that shouldn't be there, triggering inflammation. If food antigens, proteins, they're not quite broken down yet, not to the point where you can take them in without a problem, like amino acids, if they get in there, your body can start thinking, oh, that looks like an invader, so I'm going to attack it. And then again, it may trigger, then you're not only attacking a corn protein or gluten protein, but you may be attacking your skin or your brain tissue. So with that, we want to look for foods and help people find those either through an elimination diet or looking at testing where we do immunoglobulin G, IgG testing through different companies. If you have those elevated, we'll ask you to stay off of those for a while and we'll see if the symptoms get better. Now again, toxins. There's a lot of studies linking toxins, and that reminds me, there are some references that I'm going to have posted on the website and Facebook where you can read some different articles about this that support this. There is conflicting evidence, so they won't always be perfectly conclusive, but to try to give you a little bit of both sides on those to see, hey, is there proof? Is Dr. Potter just making this up? Is functional medicine making this up? No, we are using cutting edge science to look at what is in the research and not just following the latest fad. These are things that have proof behind them. So with that, you look at toxins, things like AstroTurf can react to the immune system. It actually increases cancer risk for children. Mercury and aluminum can increase your risk of reacting. Mercury for thyroid antibodies, aluminum for food antibodies, which then creates leaky gut, which then again potentially increases the risk of autoimmune disease. Smoking, you're bringing a lot of toxins in. It's causing inflammation. More inflammation, the more risk of autoimmune disease. Alcohol can then suppress the immune system and allow infections to rise up. Those infections can then trigger autoimmune issues. Now, the other issue can be deficiencies. If our body's ability to heal is decreased, then though it may be reacting appropriately, if tissues can't heal, the immune system is dysregulated, we may find that the body ends up in an autoimmune state rather than in a proper immune state. Infections. So how do infections trigger autoimmunity? Kind of like the leaky gut issue and food antigens. If your body, and this is called mimicry, thinks, oh, your body tissue looks like that infection you had last week, the antibodies that were directed to the infection may start turning on your body tissue. That's one of the ideas. Often there's also a theory of innocent bystanders, meaning that if you have a virus in a cell and your body attacks the virus, because it's in that cell. The cell gets caught up in that, and your body will sometimes start attacking your own cells as well. EBV has definitely been linked to a number of autoimmune diseases, anything from Epstein-Barr to multiple sclerosis. And like I talked about, gut bacteria like Prevotella and some others can be risk factors for developing autoimmune disease. Now, we're talking about infections, so yes, even vaccines. There are some links, some studies out there showing that a small number of people, this is not the majority, this is somewhat rare, but some people do have autoimmune reactions. There's an autoimmune syndrome associated, autoimmune syndrome induced by adjuvants, where people get antibodies after certain vaccines. Flu and Gardasil are a couple of those that are out there. Now, not everybody does. It's a small risk, but we don't have good markers to know who's genetically prone. And again, it's probably not just that vaccine. It may be the person who has some mold or has Lyme disease or has Epstein-Barr and then the shot, or has some genetic markers plus some mercury, then the shot. Usually it's not just one thing that triggers it. It's usually a combination of those things, and we have to look for all of those. Now, how do you treat all this if you find these things? Well, there's a basic foundation. If someone comes with autoimmune disease, we're going to put them on an anti-inflammatory diet. We can at least get the symptoms and the inflammation turned down while we're looking for those root causes, which are the bigger things we want to look for because they will have more long-term benefit. But that anti-inflammatory diet, where you're eating low processed foods, where you're eating phytonutrients, so the rainbow of colors actually does have a good spectrum of the different nutrients you need, making sure you're getting all your vitamins. We will often test vitamin levels using organic acids to see if someone has adequate vitamins, so that way they can heal better from the diseases, lower inflammation. We want to make sure you're eating low sugar, you're avoiding anything artificial colors and dyes, processed foods that may be causing more inflammation. A lot of patients feel a lot better with that, but then we may look at using things like curcumin, vitamin D, boswellia, cat's claw, anti-inflammatory herbs, either in food or in supplements that will help patients feel better and modulate the immune system. While we're doing that, though, that's a basic. To personalize from there, we want to know what the root causes are. One patient, it may be mold, and we need to go through a detox program of pulling those toxins out in their stool, pulling those toxins out in their urine, potentially helping them sweat more so they get those toxins out, and helping them find the mold so that way they don't keep getting exposed to it. We want to find those root causes and deal with them. With that, we personalize things. It may be one person is sensitive to gluten, another person is sensitive to corn. We're not going to have everybody off gluten or everybody off corn, but we will have you try some of those things either through testing or through an elimination diet where we cut those foods out for 4 to 6 weeks, 4 to 8 weeks, and see if people get better. We've had patients have autoimmune issues improve or resolve with avoiding anywhere from corn to dairy to eggs to gluten to a lot of random things that you might not expect, but we do see major differences with that. Oh, the other thing I wanted to mention, we look at pathways like NRF2. NRF2, it's a pathway of anti-inflammation versus NF-kappa B, which causes inflammation. So we look at some of those herbals we use, like I said, the curcumin, boswellia, using beta-glucans, probiotics. If we're dealing with infections, we may actually want to boost the immune system a little bit to get rid of those infections and attack those infections directly. So with that, we're going to look at treating, again, autoimmune disease where your body's attacking itself by lowering inflammation, modulating the immune system, and looking for root causes. Those root causes may include anything from food triggers, infection triggers, toxin triggers, deficiencies which disable the immune system from functioning properly. We treat each one of those individually. Each patient looks different, very personalized program. Even though the principles apply to everybody, they apply differently to each person. So with that, we will take some time to answer a few questions and get as many of those answered as we can today. So first of all, I will remind any of you out there, this is not, can't give direct medical advice and treat you, even if you are my patient. I wanted to have an interaction with you, first of all, in a private setting, and second of all, making sure that we look at your chart and understand your whole picture, not just shooting from the hip. So we'll start with once I've been on the detox treatment and I've remediated the house, do I continue this protocol the rest of my life? Thank you, Lynette. I believe this is regarding, well, somewhat can be regarding detox in general for anything, but specifically for mold. Mold detox is typically something that people need anywhere from 2 to maybe 12 months. So the full-blown program means you're really having a lot of toxins in your body. Once you get away from it, we start that clock ticking and say, oh, yes, let's pull those out. And as long as you're not putting toxins back in your body's sink, that sink bowl where it's built up and overflowing, once we've drained those out and you're not putting those toxins back in significant amounts, no, we're not necessarily going to have someone on lifelong detox. Now, full detox, I'll put it that way. You may be taking smaller number or have some things over to the side because we live in a toxic world and we all have occasional exposures. You visit a family member who has some mold in their house, or you go into a store and you feel, oh, I feel weird, I feel sick, some of those symptoms come back. You may do something like take some glutathione. Glutathione will help knock the edge off of that and help your body detox a little faster. So you're always going to have to think about it, but you're not necessarily going to be on a full-blown detox. Now, I do have those patients sometimes with their genetics where they just are horrible detoxers, not just for mold, but other toxins, glutathione pathway problems, methylation cycle problems. Some of those patients will be on a little bit more therapy lifelong versus someone who, once they got things cleaned out, their genetics are relatively good, and as long as they stay away from things, they may not ever have to take anything else. So there's a wide variety of responses, and that's why we kind of watch patients and help you determine how to listen to your body to know when, oh, yes, you do need more, using genetics, using tests, using just our history and physical and time spent with you. So no, ideally it's not lifelong. It's a lifelong awareness with a few little things here and there, but not something where you're doing the full-blown detox forever. Because yes, I understand could be overwhelming and very frustrating. So could mold, next question is, could mold have any effect on my blood sugar issues? So mold does a lot of things. None of those are really good. Mold affects anywhere from the neurologic system to the immune system to the endocrine system to respiratory, cardiovascular, to your skin, to your GI system, to your detox pathways. One of the other ways is through your mitochondria. So your mitochondria are little organelles, little smaller, our cells are tiny, microscopic, but little organelles inside packets of protoplasm with a membrane where you have your respiration, your energy production, the furnace of the cell to take carbs, fats, proteins, and turn into energy. Some of the mold toxins can interfere with that process, making the mitochondria not work as well, or potentially hindering the transport of nutrients to the mitochondria. Sometimes kind of the mitochondria, the way they work, they build up an electrochemical gradient. Sometimes those mycotoxins can disable that, so you can't build up a charge, I guess, of sorts like a battery, short circuits things. So in those cases, it may inhibit your ability to utilize sugar as well. Now, we typically don't see patients have really high sugars from that, but where the issue is more the metabolic is when that's turned off, there's inflammation. It's not a direct effect of the mycotoxins from what we can tell. It's more of a causing inflammation. Inflammation then can trigger an elevation in the blood sugar, inhibiting your body's ability to lower those. Now, in other cases, mold toxins could potentially, in another mechanism, cause your blood sugar to drop. So if you look at someone who is having hormone problems, say cortisol, cortisol can go up, which higher cortisol will raise your blood sugar as well as your blood pressure. However, if that cortisol goes down because your mold toxins you're exposed to is inhibiting that HPA, hypothalamic pituitary axis, adrenal axis, your cortisol may be low, and if your sugar dips, you don't have the cortisol response to raise it, or your adrenal glands don't put out any adrenaline to raise your sugar. So your sugar, instead of going here and bouncing up, all of a sudden keeps going down, you don't have hormones or your autonomic nervous system to make up for that. With that in mind, mold in a few cases can occasionally increase the risk of hypoglycemia or low blood sugar. So we do see that occasionally. So it could be either way. And again, it could be a little bit of both. You may have times when your sugar goes up and sugar goes down, especially if you're on diabetic medicines. Maybe keeping it controlled, but all of a sudden it goes too far and your body can't compensate, and you're more likely to have what we call the brittle diabetes, where you're swinging up and down a lot more. So with that, if there's any more questions out there, I don't see any right now. I'm going to give a few minutes, maybe a shorter. I've done an autoimmune talk last year, so a lot of the questions may have been answered then. But if you have any more, I'm going to hang around for a few more minutes, or even just other questions about mold or toxins or any other connections as well. So one thing I actually will do, a course that I'm listening to right now is stress and effects on the body. And one of the things it mentioned, it goes over a lot of different effects of stress on the body, but it was talking about the effects of stress on our health and socioeconomic status, kind of where we are in the demographic ladder in any country, that the higher stress affects the immune system, our neurologic, endocrine, all those systems. But in the case of the immune system, it does suppress it, so that you're have more infections. And in case of just illness in general, whether it's cancer, autoimmune disease, infections, people who have higher stress have higher health problems. And when we look at that, it's really a lot of what we talk about holistic health at Sanctuary Functional Medicine, that when we are trying to help you recover, it's not just about, oh, take this supplement, take this medicine, do this test, but helping patients to think through their life, looking whether it's their faith, whether it's their emotions, how they process things. Are you more of a person who runs over things in your head over and over again, whether you're someone who more runs away from things and hides away from it and the problems build up. It's trying to help people think through how they can handle what often is the overwhelming nature of, say, mold detox or other chronic illnesses that they're experiencing. So what we look at is that stress factor can be just as big in many studies as a lot of the other things, even as much as whether you smoke, with cardiovascular disease, for example, whether you smoke, whether you drink, whether your cholesterol is high, stress can be just as big an issue. And we hear the whole type A personality issue as well. People who are more stressed, who feel stressed more, do have more heart attacks. And there's definitely links. Some of the references that will be on the website for today's talk mention how stress does seem to be linked, in many cases, autoimmune disease. One of the other things I've heard in the past is when people go through repeated stressors, the cortisol level, which goes up with stress, is doing a lot of ups and downs, and your body begins to lose its ability to recognize self versus enemy, and that triggers some of those processes, the fluctuations of the cortisol. But we also see that somewhat with just chronic overall stress, where people are always chronically stressed, not the up and down major events, which is why one of the things we look at adverse childhood events, meaning if someone has been abused as a child, gone through difficult circumstances, bullying, death of a family member or a parent, we will see them having more health issues, more autoimmune disease, cardiovascular, again, the long list of things. So we want to help patients find those answers, not just the biological side, but the emotional, the spiritual, the mental side as well. So question, can you address histamine intolerance in relation to chronic exposure to mold, from Amanda? All right, let's take a minute for a mold question. So first of all, histamine. Histamine is a chemical that our body uses as a signal, kind of a cytokine, hormone, whatever you want to call it. It's a chemical produced in cells, released into the environment. Other cells, it binds receptors on other cells, and it triggers those other cells or tells those other cells to respond differently. In terms of allergies, when you have hay fever, allergic rhinitis, hives. For the most part, that you're seeing the direct effects of histamine causing swelling, increased fluid in your tissue, releasing from blood vessels, redness. It also, their immune system uses that to trigger, say, leaky gut, or trigger and say, hey, everybody come over here, there's a problem here, bring more blood flow, bring more immune cells. Now, it also, in some situations, appears linked to migraines and some other chronic GI issues, again, eczema, other allergic type things. So histamine is important, though. It helps our immune system do its job. Just when you get too much of it, like much of our body, God designed our body to live between the ditches. Not too much and not too little. In this case, histamine intolerance means a patient either has too much histamine. You want histamine to come and go away, so that way whatever is triggering it, once it's gone, histamine goes away. If you can't get rid of that because you have a single nucleotide polymorphism like a SNP, where HNMT or DAO doesn't work as well, enzymes that break down histamine, the histamine comes and stays around a lot longer, or even builds up more. So that's one potential issue. Your symptoms last longer than they should. Or the fact is you have hypersensitive, you produce too much is the first thing. So you're making too much histamine because, say, mold causes your cells, mast cells mainly, to release a whole lot and to make more. So rather than getting this much, you get this much, and it overwhelms, and you have a lot more symptoms that last longer. Now you add that to someone who has a genetic predisposition, can't break it down, or the next thing is the receptors on those other cells that are receiving the signal are really sensitive. So instead of needing this much to react, they only need this much, but then you give them that much. You're asking for trouble, so you've got a hyperreaction. It can't go away because you can't break it down, and you're breaking too much in the first place. So if you put all three of those, that trifecta together, you definitely see symptoms. So histamine intolerance is when patients can't tolerate environmental triggers, either releasing or causing the release of histamine. That can be in foods. Fermented foods have some histamine. Anytime you're breaking down histidine in proteins, produces that. A lot of foods, bacteria make that. So if you have leftovers a few days later or leaving something sitting out, you'll have that issue. If you have some infections can trigger some histamine. It's not quite as common as the foods. Then other foods, say like citrus foods, they just cause your body to release some histamine. Histamine that you've already got there. But then you throw on top of that, say you have a parasite, can raise histamine levels through causing immunoglobulin E, IgE, to be released from allergy cells. Or you go out and you have exposed oak, pine, whatever symptoms causing allergies, you can get that. So you can be getting some inhalational exposure to triggers that cause release of histamine. You could get that from eating something. You could get that from just having a toxin. So with that, histamine does all those things. Histamine intolerance is when you either have too much, sticks around too long, or you're hypersensitive to it. And mold patients often have that issue. So now, why do mold patients have that issue? Mold, one of the bigger effects it has is dysregulating the immune system. So we're aware of its effects, say, on the complement system, which is why we look at C4A and C3A, having effects on the cytokine system, the immune messengers, immune chemical messengers like TGF-beta1. It may lower cortisol, which helps dampen some of the allergic response from your adrenals. It may also make your mast cells more sensitive, so it makes them more likely to release a higher level of histamine than they would otherwise. So when we're looking at that, we're trying to determine, is it genetics? Is it how many triggers you're eating? Somebody goes, oh, I'm trying to be really good. I'm eating fermented foods 3 times a day. Well, maybe they're overloading their system and they're not ready for that. Or it's just the fact they're under a lot of toxin exposures, or it's that time of spring, fall, where there's more pollen out, they're getting extra histamine, and we have many patients who only have those issues during those seasons. Or other patients who say only when pollen, one particular patient who would only react to eating eggs in spring and fall. Well, we determined it was only during the time that there was oak pollinating. Once that went away, they could actually go back and eat eggs. But during that season, eggs plus oak would give him enough of a reaction together, whereas neither one by itself. He didn't eat eggs, he didn't really have that bad a reaction with just the oak, but when you put the two together, it was an issue. So mold is connected, increases those cytokines. We don't completely understand all the ways, but that is something we are going to at least think through with 100% of our patients who are going through mold toxicity, is determining whether they have some histamine issues, mast cell sensitivity, histamine intolerance, and addressing that with therapies, whether it's quercetin, bromelain, NAC, there's some other chondroitin, Kela. There's some pharmaceuticals out there that tend to be more expensive, like gastrocrom, and sometimes we will even use the pharmaceuticals like the Allegra, the Zyrtex, something like Zantac for gut histamine issues. We'll turn down. That's actually a histamine blocker for the GI tract. So those are things that we will do there. So let's to next for Brad. Can cladosporium mold have adverse effects on someone who already suffers from mold illness? So let's, another mold question. Thank you for that. So let's talk about mold and toxins and mold toxins, not just mold and toxins themselves. But with that, there are molds that don't produce toxins. A lot of those are more outdoor molds. Then there are molds that only produce toxins under certain conditions. And a lot of those times are when they're somewhat threatened, meaning the water level is going down, they're kind of fighting for the last water, and maybe they're sending toxins off to kill off another species while they're trying to keep themselves alive, or they're being sprayed with bleach and they're starting to produce toxins. Or there's also an indication that electromagnetic frequencies, EMF, can cause mold to produce more toxins. So there's something triggering that, or they come in contact with other molds and they're fighting for food. So there's kind of a competition in that. With that, certain molds, again, more allergic, don't necessarily make toxins, or at least not ones that cause us problems. Other ones make them, but maybe only in certain conditions. And then we look at, okay, the ones that do make toxins, cladosporium can, any of them potentially can make a little bit. So it's always, if we see that in a higher level in a patient who's experiencing mold symptoms with lab tests and symptoms that go along with that, and we find that in the environment, we're going to look at cleaning that up, because other aspects, certain molds, even if this one, it means there's definitely water issues. It means other ones, and also bacterial toxins can live in some of those same environments, and we may find that, oh, it's not just the mold that's an issue, but it's some actinomycetes, a type of bacteria, or other bacterial endotoxins that are doing that. So that can be an issue, and that reaction to, say, cladosporium, or we could fill in the blank with other ones, may be a toxin. So that cladosporium could be producing toxins, or that person is reacting to another toxin, or it could be the fact that that person being exposed to mold, their immune system, as we just talked about, is upregulated to cause histamine issues. So now they're allergic to cladosporium, whereas normally they wouldn't have been if they hadn't been exposed to the mycotoxins. So it could be toxicity, it could be an allergy. So we would look for a patient like that. We would try to see, all right, we want to lower as much as possible their exposure to any of the molds, especially the indoor water damage building molds. And then if they are reacting with allergic symptoms to the outdoor molds, help them know how to navigate that as well. So hopefully that kind of answers that question. You know, the short answer is yes, you could be reacting, but it may be in two different ways, or both. Just because somebody's having mold toxicity doesn't mean that they are or are not, or can't be, allergic to mold as well. Which I'll take for, if you've not heard me say this before, is we'll just take a moment about mold, mold toxins, mold effects on health. So you can have allergies, meaning you go out, sniffle, snot, sneeze, wheeze, and break out in a rash. It's something that's triggered immune reaction to usually IgE and histamine. People can be miserable from this, but usually it's not life-threatening unless it's an anaphylactic reaction. It's more of a, oh, this is miserable, causes problems, I have to take some medicines. But it's typically allergic symptoms. You have infections. Infections from mold are typically in someone who's very young, like a neonatal NICU, intensive care for the neonate, preemies, or the older or the immune suppressed. Somebody's on chronic steroids, somebody has HIV, somebody who's 70 or 80 years old and have tons of antibiotics, and they've got you cleaned out all their good gut flora, and they're at higher risk for getting some of these molds or fungi in there. Those are patients are much sicker, be life-threatening, and require more of an aggressive anti-infective, killing off those things that have invaded them and are living in them and causing problems. What we're talking about with mold toxicity is more the side of things where someone is not allergic, well, they may develop allergies to it and other things later. They're not really infected, may not be living in them at all, although we do have some patients who the mold is actually probably in their sinuses or even in their lungs. But for the most part, it's outside, and they're breathing this in, usually not on their skin, but more inhalational, in the nose, mucous membranes, into the lungs, maybe or maybe not by food sources. That's kind of debatable, but at least inhaling those, and they're not really able to get them out, so those build up reactions and make them very sick. So it's a toxin, like you normally think of a toxin, a poison, hurt someone in some way. Now, some toxins hurt one part of the body, some toxins another. Mold can in some form or fashion, hurt every part of the body, although some parts are more often, and not everybody is affected in the same body part, the same body system. But we're talking about toxicities where not an infection, not an allergy, but it's a toxicity that dysregulates your normal body metabolic functions. And that's the different ways mold can affect someone. And now you can have all of those. You could have an infection that's producing toxins and you're allergic to. Yes, those patients tend to be pretty sick, but we thankfully don't see those very often. So if there's any more questions, we still have a little more time. If we don't have questions, I will probably wrap it up a little bit early. So I'll give you a minute or two. While we're doing that, I will mention, if you don't have a functional medicine doctor that you feel comfortable with, that is helping you sort through root causes, looking outside the conventional box, Sanctuary, we are taking patients. Myself, Dr. Potter, Hans Hinterkopf, my physician assistant, and Beth Elizabeth York, who takes care of our hormones. We all work together as a team here where we're trying to provide comprehensive care. We don't do procedures, so we're not cutting you open. We're not really poking things in you. We are not catching babies. We let others that are much better do those things. But we're trying to find those patients who have chronic illnesses that can't get answers, who've been to different places, sometimes 10, 15, 20 or more, doctors, providers, and are looking for the whys, the root causes, how to get better. That's kind of patients we see. We also like those who just have some minor problems or are wanting prevention, especially if you have a family history, say Alzheimer's, heart disease, autoimmune disease. We like catching those where, oh, hey, we can prevent some damage. This is exciting because we can give you life that you might have lost otherwise. So please, come see us for those things as well. But we do take care of those chronic illnesses, helping you get answers that others have not provided. Stephen can give you more information, 615-815-5941, to help you know if it's a good fit. He'll answer those questions for you. So with that, I think we will wrap it up here at about a 45-minute time. If others watch this later, I do try to come back and answer questions as I notice them. So if you have a question about autoimmune disease later, come back, leave it on the Facebook, and we will get back to you. So until then, next 2 weeks from now, I think it's is it Mold and Travel? I think how to travel with mold toxicity. I think is the next one on May 23rd. Trying to find that for sure. Here we go, found. Yes, May 23rd, 11:30, 12:30, travel health for mold toxicity. So I look forward to sharing some insights there, both from personal and professional experience. So until then, have a blessed day. This is Dr. Eric Potter, Functional MD, signing off from Facebook Live, Sanctuary Functional Medicine.